Dr. Cannon. I'm a nurse in the Pediatric Intensive Care Unit. My poster presentation is on early enteral nutrition in the critically ill child. Early enteral nutrition support is vital to the recovery of a child with a severe illness. Malnutrition is prevalent among a majority of PICU patients and leads to increased length of stay and mortality. It also reduces complications and improves outcomes. And the severe illness leaves the body in a catabolic state. Early enteral nutrition reduces this risk, as well as malnutrition, preserves intestinal integrity, and supports immune defenses. It is beneficial in wound healing, improved intestinal function, and decreases the catabolic response of the body. My PICO question that I formulated to begin an article search was, in children admitted to the intensive care unit, does early enteral feedings compared with delayed enteral feedings decrease the length of stay in the ICU? My methodology was to review PubMed, CINAHL, the SAGE journals, and the Virginia Henderson Global Repository. I used several keywords: child, critical illness, early enteral feedings, outcome, and pediatric, to name a few. This yielded up to 692 results. I then decreased my yield by narrowing it to year and the quality of study, and then brought that 3 down to the ones that most accurately answered my PICO question. For my summary of evidence, the first article in Mikala et al. It was to examine the association between early enteral feedings and morbidity and mortality. It was a retrospective study throughout 12 PICUs in the United States. One of their variable studies was PICU length of stay, and their results were that critically ill children do benefit from early enteral nutrition, and they are more likely to survive. And then the secondary endpoint was that PICU length of stay was not affected whether the nutrition was started early or late. The second one is Petrillo-Albarano et al. This was to evaluate whether instituting a feeding protocol and a bowel regimen were beneficial to reaching goal feeds. One of their variables, it's a retrospective study, one of their variables was the days in the PICU. Their results were that the feeding protocol and the bowel regimen did accomplish feeding to be started and reach their goal feedings in an earlier time, and that PICU length of stay was not affected by whether early enteral feedings had been started. And my third one was Wong et al., and theirs was a systematic review of literature, 9 sample studies. One of their variables was PICU length of stay, and whether or not the effectiveness of a feeding protocol was beneficial. Their study also proved that the early enteral feedings had no direct effect to the length of stay. The recommendations that were mirrored through all 3 of these articles was that early initiation of caloric intake in conjunction with a bowel regimen resulted in improved tolerance of feedings, patient outcomes, and overall nutritional state of the child, as well as improved times to initiating feeds and time to reach goal when the patient was placed on a standardized feeding protocol. And then all 3 articles also suggested more research for the critically ill child and nutritional feedings. In conclusion, the pediatric length of stay was not significantly affected by the initiation of early enteral feedings, and it has been proven that to be beneficial in improving the outcomes of the critically ill child, and as well as further studies are pertinent to clearly identify barriers that are preventing optimal nutrition in the critically ill child. Thank you.